everyone. I'm Saujanya Vemuri, a product leader turned metabolic health coach. And I have Dr. Sonia with me, a leading dermatologist at the Sikara Skincare here in Hyderabad. And we thought it would be interesting to put together a series on metabolic health. There is so much jargon around what metabolism is and what metabolic health is, often misunderstood. So our attempt here is to uncover, some of the truth behind, why we're getting sick these days, and a lot of us are getting sick, and the underlying core reason for this is insulin resistance. And today my conversation with Dr. Sonia is going to be about that very topic, which is, if you will, the elephant in the room. Hopefully our conversation today is going to help scratch the surface on what insulin resistance is and why it matters, and give you some tips and interventions on self-diagnosing if you're one of those people who may be suffering from insulin resistance, and what you can do about that. Hopefully, we give you some knowledge and education to improve your health through this conversation, because we do believe that better knowledge is better health. With that said, I'll pass on the mic to Dr. Sonia to introduce herself.
Thank you, Saujanya. I'm Dr. Sonia Lather, dermatologist at Sikara Clinics. I think she has given a good introduction of what we are going to talk about today. So let's just dig in. So let's just start with something very basic, like what is insulin? Everybody has heard the name, but what does it mean? Like, what is insulin?
Yeah.
So insulin is a hormone which is produced by beta cells of pancreas. And what it does is it basically keeps your glucose in check. That's the basic thing that what it does. And what does it mean when we talk about insulin resistance?
Yeah, for sure. I think just to add to that, I think insulin is also an anabolic hormone. What that means, and there's a reason why I bring that up, and you'll soon know. The reason is insulin's main purpose is to store fat, right? Which is anabolic. And your cells either store fat or use it to burn and give you energy. So there are two things that cells do. And in the presence of insulin, your cells are always storing fat, right? And this is very evolutionary, and obviously evolution is not an idiot. There's a reason why it's been designed like this, because when food was abundant and you got food, then you needed insulin to take that and store for a rainy day. Unlike today, you don't get food in abundance. There weren't refrigerators. So till you gather your next hunt or, feed yourself, which you don't know how many days later it would be, this one meal that you got could serve as your slow release of energy through fat storage, right? That is really why insulin is so important, right, as a hormone. Because I don't want any of our audience to feel at the end of this, when we get into insulin resistance, to feel insulin is an enemy. It's not.
That's true.
There's a purpose for
Yes.
it. And this is the purpose, right? It helps with the fat storage when you don't have food, and you can tap into those sources to give you energy. Now, as Dr. Sonia said, what is, and insulin has a purpose. Amongst many, its most primary purpose is to take the cells from the blood, take the sugar from the bloodstream and put it into cells, right? Now, in a system that works seamlessly, right? The sugar is going into cells, being used up as active energy when you need it.
Yes.
Or being stored when you don't need it. This is a perfectly working system, right? Now, in an insulin resistance state, what's happening is the doorway to the cell is shut when insulin is knocking on it, right? So let's sort of walk this through in a real world scenario, right? You had that roti,
Yes.
or that piece of bread. You had your meal. When you have that piece of roti or bread, your pancreas basically get that signal that you've eaten something. And here we'll get into what triggers insulin versus what doesn't. So pancreas immediately secrete insulin because the blood glucose has increased as a result of eating roti or bread, right? It's increased more than 5 ml, which is about the capacity of sugar your blood can store, right? So once that happens, your pancreas secrete insulin. Insulin comes to duty, is taking that blood, taking that sugar, and it knocks on the cells, saying, consume this sugar, right? There will be some cells in the body that will say, no, I'm not going to open this door for you to shove glucose in, right? And this can vary in that spectrum. There'll be some cells which just don't open the door when insulin is knocking. There'll be some which may partially open the door and shove in some sugar into that cell, right? So as a result, what happens is when these cells are not being receptive and responsive to insulin signal, the sugar or glucose that was meant to be shoved into the cell continues to be in the bloodstream, right? That's when your glucose goes up, right? And so this state of cells not being receptive to insulin signals knock on their door is basically insulin resistance, right? And then you would wonder, like, wait a minute, then why are they not being receptive in the first place? And that comes. There are many reasons, but the primary reason in this day and age is your diet and lifestyle, right? The abuse you've done to the cell, which is now saying, I've had enough of this. It's the same thing, right? When you overdo something, at some point, that person, or when you push someone too much, they're going to push back. That's what's happening with cells, where insulin has knocked on their door so often and so much that they don't want it anymore. And that's at which point they say, I don't want it. And then why is insulin knocking on the door so much and so often, right, is what we want to dig into this while we talk, right?
That's true. Very well explained. So in simple terms, when you're eating foods which are very high glycemic, constantly foods which have high glycemic load, you are telling your pancreas to repeatedly release the insulin.
Yes.
And it, as you said, it keeps on knocking because of this high glycemic foods that please let the sugar go in the cells, and after a point of time, the cells have had enough throughout, and it doesn't open the door, so insulin just keeps on just getting high. So this is something that we have seen in insulin resistance. Initially, you will have something called as hyperglycemia, that is increased blood sugar. The insulin levels might stay normal, but after a point of time that we have seen, along with hyperglycemia, patients also have hyperinsulinemia. So even though the body feels the glucose is high, so it kinds of gets the signal that you need to make more insulin, you need to release insulin constantly in the blood for the sugar that is high that needs to be uptaken by these cells.
Yeah.
But since the glucose is high, so repeatedly the insulin keeps on getting high. So along with the high glucose, we also have high insulin.
100% right. You're right. It's so interesting you bring that up, because I see insulin resistance as this coin, right? It is a coin because it has two sides to it. One is, as you rightly put, one is the insulin resistance, which is happening at a cell level. But then at a systemic level, which is the flip side of the coin, is hyperinsulinemia. Right? So it is not possible to have hyperinsulinemia without insulin resistance. So and again, I think we have to clarify that not every tissue and every cell is insulin resistant for you to be hyperinsulinemia, right?
That's true.
Right? And of course, there's a whole science behind where it begins. And I think there are honestly, and probably you know better than I do, we're uncovering so much of this now. There are more questions than answers, right? There is some research around where insulin resistance could potentially start, in which tissue, and the current research says it's the fat cells. But that's an ongoing research, and I think it'll be interesting to bring up those topics eventually. So yeah, and I think having given this analogy of a coin, where you're insulin resistant in some tissues, as a result you're in hyperinsulinemia because that glucose remains high because some of your cells are not working great. As a result, insulin remains high and you're hyperinsulinemia. So then why are we even talking about all of this, right? Like, why should I care? What if I'm insulin resistant? I seem to be doing fine. But I guess the question is, are you really doing fine, right? Like, what does fine mean? It is so subjective. Are you really healthy, right, is the question. People say, dude, I go to CrossFit every day. I have a six-pack. I run every day. I eat healthy, right? But am I energetic? Are my cells really functioning the way they should be, right? I don't think so. Or maybe not, possibly not, right? So I think it's important to realize that you cannot run your way out of a bad diet. You cannot consume food that is going to trigger your insulin and then go run a marathon, right? Or and there are many aspects of why you would get insulin resistance, right? Obviously, there's a genetics aspect of it, but what research says is that is way lesser than like 30. The best case scenario where like your genetics have caused insulin resistance to be harmful to you is really under 30%, right? So genetics loads the gun. So what triggers the gun is diet and lifestyle. So a huge portion of how insulin resistance is actually harming you is how you're living on a day-to-day basis, right? The genetics is out of your control, but what is in your control is what you do meal by meal, day by day, moment by moment. And I think we should talk about that as well, right? So Dr. Sonia, you get patients all the time. When you bring up this topic about insulin resistance, I'm curious, what is their reaction or their curiosity to know what to do to make sure that they aren't going down that path and they can do something about it? Do you have these conversations with them?
Yeah, so I just want to mention about the genetic aspect. One thing I want to say is a lot of us, we inherit a lot of things from our parents. That's, as you said, it's out of our control. There is nothing we can do about it. But if you even see in the same family, if there are two kids, both of them have genetically inherited.
Yeah.
But not necessary, both of them are going to have
Type 2 diabetes.
Type 2 diabetes, yeah, that is true. So what is it that one kid is doing differently from the other? Is it just the lifestyle? Is it the environment where they're living? It's the stress level. Everything matters.
Exactly.
And why is it important now? Because number one, obviously the rate of type 2 diabetes significantly high, and India is almost on the top of the list.
Yeah.
It's why. We will talk about this a little more, like as compared to the Western countries, we see people are much more overweight. But why are they not getting diabetes as compared to us? We have people who are not really overweight, but significantly insulin resistance, and they are ending up getting diabetes. Now, in terms of when I see patients in the clinic, so I see patients who are very skinny and they comes with complaint of acne, hair loss, pigmentation, significant pigmentation, periocular, around the eyes, pigmentation, perioral pigmentation, neck is dark, underarms are dark, and they are thinking this is all something, pigmentary issue, but not. A lot of it is because of due to insulin resistance. So I want to mention this. What happens is insulin it's a hormone that is kind of at the center of it, and it basically controls a lot of the other
Oh, yeah.
hormones. So what happens in terms of skin specifically? I would mention. So in the epidermis, there are different layers. Okay, and then comes the dermis. So there are two main cells where insulin plays a role. Number one is keratinocytes. That's the main, are cells which multiply. And insulin it's a growth hormone. We
Yeah.
need insulin. Why do we
Yeah.
tell, it's important. It's a very, very important hormone. Our kids need insulin, that's how they grow. It's a growth hormone. So there is something called as insulin-like growth factor. The insulin goes and attaches to insulin-like growth factor, and that's when it basically makes us grow, Like kids, they need to grow. And that's why insulin is such an important hormone. We tell our kids, drink milk. It's an insulinotropic thing, They take it in diet and it helps them in growth. Versus in adulthood, insulin also makes things grow, but not what we want to grow. So basically our epidermal cells, they are multiplying at a much faster rate. So this is what it causes thickening, and this where it causes this velvety appearance, something we call as acanthosis nigricans, and it's basically a clear sign of insulin resistance. But when I mention this to my patient that we need to just dig deeper into it, and most of the people would be like, can we do something to just take care of this pigmentation, and it would go deeper. So this is something where everyone needs to understand that skin is not just what you see. There is a lot of it going internally. So you would not believe, I have diagnosed a lot of insulin resistance as well as type 2 diabetes just from the clinical presentation the patient comes with. So a lot of education needs to be in this department, where people need to understand what this is, what are the different aspects of it. I can talk about the skin aspect of it. It can range from acne, pimples, darkening, hair loss. There have been a lot of studies. Initially, it was thought that insulin resistance actually has a role in hair loss. So what happens is, because of constantly high insulin, as we mentioned before, you are storing more fat. So lipogenesis is the medical term for it. You are increasing fat production in the body. Secondly, what is happening is two female hormone, LH and FSH, are constantly increased. So they stimulate your ovaries, and they tell them to produce more hormones, which are the androgens. That's where all these things, PCOD, polycystic ovarian disease, and all these things come. So androgens, what are the androgens that are there? Testosterone is a very androgen. And then other thing is dihydrotestosterone. So increased dihydrotestosterone, it attaches itself to your hair, and that's when the male pattern hair loss, female pattern hair loss. Okay? Again, oily skin. Increase DHT. It basically increase androgen. So patient will come with, I have an oily skin, Same thing. This is what happens even in your teenage years. Why do you have? Because androgens are high. That's because of your teenage. But also in an older generation, where they will say, doctor, my scalp is really oily, my skin is really oily, I'm breaking out into pimples. So now we have another type of acne, which is insulin dependent acne, in older years. So we need to, this is something very important. And as you mentioned before, that why is it important to talk right now? Because number one, science has advanced enough where we can relate a lot of things, and we have enough evidence that if we treat insulin resistance, a lot of this can be treated. So
for sure,
that definitely has
so I threw a really big word at you guys, lipolysis. So what is lipolysis? Basically breakdown of fat, right? So when insulin is in the bloodstream, you're not breaking down fat, you're only storing fat. So going full circle, you being metabolically flexible is the way to ensure that what you eat gets used up as active energy, and when you're not eating, your fat reserves come to your rescue, right? And I'm going to use this as a segue to ask Dr. Sonia, a burning question in my head, which is, patients come to you, and I'm really curious if you hear them talk about this constant hunger, need to eat, constantly craving glucose or sugar or sugary things, no matter how much they feed themselves, right? That's one. And at the end of the day, are they actually feeling energetic? Or do they feel this brain fog and they still have to go take that afternoon nap? What has been your experience with your patients with respect to that as a feedback or that as a concern,
So this is something which we see commonly, like especially I feel like young females, they would say that always like they would eat 1 or 2 chocolates, and after some time, I think what happens is the sugar goes high and they feel little energetic, and then there is a drop in sugar because again insulin is high, that glucose is utilized, the glucose goes down, and there is this constant need for sugary stuff. It's always sugar. So this is something that any patient of acne I see, especially in like even older age, younger age, this is something which I always ask my patient, do you feel like, craving for sugar? And most of the time they would answer yes. So it just helps me to take the diagnosis in the sense. Obviously, we also look for other signs of hyperglycemia and hyperinsulinemia on the skin and hair as well. But this is something which is very classic. So having the sugary thing, it makes your energy high, but that's only for some point of time. So this is something which I've been doing with my patients, where we try to go off sugar. And believe me, initially for them it seems, oh, this is such a difficult thing, we can't leave, because this is something they feel that this is where they are getting their energy levels. So after a month of 2 being off sugar, most of them would see a significant improvement in their skin and also in their energy levels. And also one other thing that we see clinically is the inflammation is significantly reduced from this decreasing sugar. So, they will say, doctor, and the need for also the medication is definitely, it goes down, then I don't need to give them so many medication. Because the inflammation goes down, so we see, acne, there are different types of acne, obviously different stages of acne. Specifically inflammatory acne, where your acne is very red. Obviously, the organism P. acne, it goes and basically your sebaceous gland are getting infected. That is causing inflammation, but also this chronic high glucose, it causing significant inflammation in your skin. As well as in your hair, and the root cause of lot of these, acne, even another skin disorder called as psoriasis, where you have these thick scaly plaques on the hair. Lot of it can be, if you go deep in scientifically, is the inflammation that is happening. So when you are going on, it's like now a lot of it is, obviously low glycemic diet and also anti-inflammatory diet. What is anti-inflammatory diet? It is same thing. You are having low glycemic and low insulinotropic food, that in simple word would be like, you are not eating foods, all carbohydrates are not bad, we will discuss about this. People think, we need to be completely off everything. No, you need to become only off things which are basically causing you to have high glycemic load, but not everything is high glycemic. You want to be eating more complex carbohydrate or carbohydrate which are more rich in fiber. That is what your diet should be, and one common thing I would mention is in terms of insulinotropic is milk. Indians are so used to having milk all their life that the idea of stopping milk is just like, what are you talking about? But this I really want to stress, it's been now very well scientifically proven. Milk is a very insulinotropic hormone,
Milk is an interesting one. Milk is an interesting one. I think the what you said have a lot of segues to have really deep conversations. One is the sugar, right? One is the inflammation, and then you bring up milk. And I think in the subsequent, podcasts, we really need to iron down on each one of them. But just to really summarize on the sugar aspect, it is, different macros trigger insulin differently from if you're purely looking at it from a nutrition perspective, right? So if I was to draw, say, a chart, right, when you consume carbohydrates, right, and in that spectrum it includes from ultra refined to, the least refined, you will still see the highest spike in insulin for this genre of food, right? That is when your pancreas are working the hardest to secrete insulin, because this is the food that releases the most glucose, because carbohydrates is basically either it's fully glucose molecule or a combination of glucose and fructose, all of which trigger, the onset of sugar being in your blood, which is why insulin has to come to the rescue and do the job, right? And now protein is the other macro, which is an interesting one, especially as people in the bodybuilding and sort of the athletic space. That also triggers insulin, but to a milder extent, right? Here again, and I want to stress this a lot, which is health is not a one-size-fits-all. Nutrition is not a one-size-fits-all. You don't want to be generalizing everything and taking things out of context, saying, I'm taking protein powder, I'm not going to be insulin resistant. It's not triggering insulin in me. Is that really true? You need to revisit that, right? So don't go with these. I think my encouragement is try to really inquire the truth, and, don't stick to sort of these more generalized concepts out there. Yes, protein in itself is great, but it comes down to how are you consuming protein? Are you consuming it in isolation as a whey isolate? Is it really doing much for you? Maybe not. Are you consuming it with the right ratio of fat? Probably yes, right? And we'll get into the nutritional sciences in the future podcast, but I will say eat real whole food. There's a reason why universe has designed food, whether it's animal products or plant products, a certain way. And your body is designed to assimilate them. If you go out of that norm, if you start creating things synthetically where you're consuming protein without fat, your body really doesn't have all the right mechanisms to take that, at least not in its entirety, right? So just to really keep it high level, we'll dive deeper. It is about, if you stay as close as possible to real whole food, whether it's carbohydrates, whether it's protein, whether it's fat, that's a huge needle mover for health. You don't even have to worry about anything else, right? You don't have to worry about, yes, there's a whole aspect of what percent of your food has to come from carbs, fat, protein. But this is also deterministic of where you are in the insulin resistance spectrum, right? If you're really insulin sensitive and your cells are working great, sure, man, 100% of your food can be carbs, right? But you're on the opposite end of the spectrum where you're really insulin resistant, and then you say, that guy eats a heap of rice every day for all 3 times in a day, and he's fine. I can eat it too. No. Listen to your body, see where you are, and you got to be, I think, mindful about how a food is making you feel, and then that. So I think that's sort of on the sugar, and just to close that out, fat almost does not trigger any insulin. Right?
Yeah,
That spoon of ghee in the morning, as an example, is not triggering insulin, right? But there are other things. It is calorie dense, and we can get into those. So it comes down to, what are you optimizing for? Are you optimizing for weight loss? Are you optimizing for improving your health biomarkers? And or are you optimizing for something else? Based on that, you have to determine how you're meals and your day looks like, right? And I think maybe this is a perfect segue to talk about, okay, the two things, right? Which is how do I know that I'm insulin resistant? What are some of those visual cues or labs that I can look at without going to a doctor to know I'm potentially insulin resistant or on that pathway? And two is, what can I do about it, right? So I think on the first one, how do I know I'm insulin resistant? This is an interesting one. Your waist to hip circumference is an interesting measurement which you can do at home. So waist to hip, for if it's greater than 0.9 for men and lesser than 0.7, greater than 0.7 for women, then you have to get serious about this. So basically that means that your waist, around your abdominal cavity, is where the fat storage is happening, right? And in subsequent podcasts, we'll talk about how the visceral fat or the fat around organs is different than fat that gets stored subcutaneously under your skin. The subcutaneous fat is healthy. You want that. It's helping you in many ways. But it is this abdominal cavity fat, so-called the visceral fat, which is pathological. In layman's term, that is causing disease. That's making you sick, right? So this waist to hip gives you an understanding of the fat composition in your body, and that puts you at a higher risk for some of these conditions like heart diseases and type 2 diabetes. That's one. The other is, now if you look at your labs, triglycerides upon HDL. That's like a very accurate way for a poor man to know if you're insulin resistant. So triglycerides upon HDL, again, this varies based on ethnic groups, but I think for South Asians, if your triglycerides upon HDL is under 2, right, you're in a good place, right? But if it's over 2, then you need to make some changes in your life. You need to start thinking about interventions, right? That's one. And I think African Americans have it like much lower. I think it's 1.5 for African Americans. So again, some of the things. So waist to hip, triglycerides. I think in general, if you're looking at your lipid panel, what are interesting things that you should consider to say you're metabolically healthy are, ideally you want your triglycerides to be under 100, right? HDL to be at least greater than 65. A lot of us feel like, oh, I'm 40 and I'm doing great. No, like, yes, I do agree HDL is, it's a genetic thing. Some people just can't get their HDL too high, which is why I think that 65 is sort of optimum. It's that sweet spot. You can still achieve it through good nutrition and lifestyle. So on your lipid panel, you want to look at this triglycerides not being above, is it above 100 or not? Is my HDL greater than 65? And I think the lipid panel is interesting because it's not, you don't want to look anything in isolation. It's a ratios of how one works with the other. And maybe, Dr. Sonia, we could do one podcast only on understanding and interpreting your lipid panel, right? And instead of going deeper, so stay tuned for that. And so these are some of the ways. And I think there are other sort of clinical ways to know it, which is through fasting insulin. HOMA-IR tests is another way to know if you're insulin resistant or not. Do not rely on your fasting glucose numbers to know if you're insulin resistant or not, right? It's interesting, like we explained what insulin resistance is, which is, listen, your body is designed to make you survive and live. So you can keep pounding it with glucose, and in the back, it's going to do everything it can to keep the glucose low. That means for a very long time, you will not even know that your glucose has gone way higher than it should, because your body has already been working so hard to keep it low. So you're already hyperinsulinemic before your body has broken down and you start seeing high glucose. Usually this is a runway of 15 to 20 years, right? And I think Dr. Sonia started off this conversation about prevention, early detection. Do not wait till the point that your glucose is so high, because it took years for insulin to be working so hard to keep it low. You know what I mean? So a lot is already happening. You're already stressing your body so much before you actually know that you're high glucose. You've been high glucose for so long, right? So these are some of the things you have to think about. And HOMA-IR is one way to find out. Start looking at your triglycerides upon HDL. Start looking at how your waist circumference is changing. The other one, which is also interesting, is waist to height. If your waist to height is, your waist should be at least half your height. If it's greater than your height, that's also something you have to think about, right? It's a sign of visceral fat. And in this context, I think people should be less worried about weight and measuring their weight constantly. It's more about body composition. So if you have access to a DEXA scan or, in body or some way to determine how the fat is distributed in your body, it's going to be a better indication of your risks, right? And maybe we should do a topic on, fat storage and where we store fat and how we store fat is more important than how much fat is there in your body. So maybe something we should note down as a future topic. So hopefully, to summarize, these are some of the, immediate indicators you can go do today to see if you're heading in that direction. And do you want to add something to that?
I think you very well mentioned that you have to look at your waist in general. If you think that you are putting more weight around your waist, that means obviously you are carrying more visceral fat as compared to having overall increased BMI. That's true. You need to look at your lipid panels, and as we already discussed, you also need to look at other metabolic factors. If you have high blood pressure, so these are few of the things which are already telling that metabolically you are not doing well. So there is a high chance you have insulin resistance. If you have access to labs, preferably, as you mentioned, rather than doing a fasting blood sugar or a PP sugar, because even the fasting blood sugar, as you mentioned earlier, obviously because of high insulin, it's going to try and decrease your blood sugar. But also it will also vary what you had in the night, what time you had your food, and what you had.
Exactly.
What you had in the dinner. If you had a chocolate cake, and in the morning if you want to check all these things are going to matter.
For sure.
Okay, so there is a right way of doing it, but simple things to start with, as I said, you can do, which are is overall, if you're seeing that you are having increase like darkening of skin, you're having acne, you're losing your hair. For females, something called as hirsutism, which is having terminal thick hair in androgen dependent area, upper lip, chin. Some people even have it on the neck, abdomen. These are the signs which are telling us you have high androgens. Okay, this combined with you have increased abdominal girth, you feel not that energetic. You feel like eating sweets always. This is already a sign you are metabolically not doing well, and you need to take a step forward in doing something about it. Now, what can you do something about it? We will give you few tips that you can already start doing things at home. First thing is obviously nutrition. Lot of people are like, what should we eat? What should we not eat? We will give you some very, very simple things that you can, make sure that you don't want to have carbohydrates, which are just going to increase your, glycemic load. So you want to have something more complex. If you are, if you are a chapati eater, we would encourage you to have something like a multi-grain, something more multi-grain rather than having a simpler things. And you want to have more fiber in your diet.
Yes.
Oats are something very good. I will mention just few simple things. Your HDL is low. You make sure you include some walnuts and some seeds in your diet so that your HDL goes up. And we cannot undermine the importance of exercise. I especially want to mention this. Throughout the entire podcast, we have said that everything we eat and we don't do this sedentary lifestyle is causing us to have increased insulin and also increase glucose. Now, you need to move your body. What it is going to do is this blood glucose, which is high, it's going to encourage your muscle to uptake that glucose, and then you don't need to release so much insulin for that. And basically your pancreas and your insulin is going to get a little rest, and that's what is needed. So make sure a good diet, number one. Exercise, we can't stress the importance of it. And as we mentioned, if you have all these clinical symptoms where you are already seeing, we want you to take a little bit, medical advice too, I would just mention the name of metformin right now. It's a very good insulin sensitizing medicine, but are you a good candidate for it? Whether you need it or you don't need it, for how long you need it, all these things you need to go to your health provider and discuss it, because this is something which is happening where you are sitting in the comfort of your home and all these problems are happening to you and you don't know what to do about it. So in today's podcast, as we discussed, simple things that you can do, how to identify whether you have this, what you can do, and obviously if you feel that you need medical help, we are there for you. You can come, you can discuss with us whether you are a right candidate to be put on medicine. And also we'll discuss this in our future podcast, who needs to take medication, who doesn't need to do it, is it? So that would be something I would like to conclude. And anything you
I
want
think just to add to what can you do about it, to Dr. Sonia's point, definitely nutrition is the elephant in the room. Your diet and your lifestyle is almost single-handedly going to determine, if you're putting your health at risk. I think the other one that's really important is stress. And going full circle back, it's how other hormones play to the tunes of insulin that ends up determining your metabolic health. So stress is a really interesting one, because it triggers epinephrine and cortisol that, by the way, don't like insulin. So they're going to make things worse for you, right, in that context. And something I think we should go into how stress causes insulin resistance in our future episodes. But stress is a really interesting one, and it's also possible that you're eating healthy, you're not triggering insulin through the food you're eating, but your stress alone could make you insulin resistant. So again, another something you have to be mindful about. And this is just so many mindfulness, meditation, breath work type of activities that you can do. Go out in the nature, just spend as much time away from screens. Research says social media is one of the biggest stressor of your life, which is ironic because I guess you're going to consume this content on social media. And I don't know if I'm even allowed to say this, but I think the third one is movement, like you said. And here, movement, I want to stress that it's not about that 1 hour going to the gym and you're done for the day. No. In fact, moving all day has proven to show more benefits than doing your 40 minutes exercise in a CrossFit or a gym lifting weights and then sitting all day. It's about having a non-sedentary lifestyle, right?
True.
And again, exercise is a topic, it's a beast in itself, right? Not everybody needs to be in CrossFit to say, I'm having movement. Movement could mean different things to different people. And honestly, movement is also a prescription. Not everybody has to be doing, what you see on TV, and every chiseled body out there. You don't have to be that to be healthy, right? So movement is also something we should talk about, but that's another way to really make you more insulin sensitive, to Dr. Sonia's point, because muscle is the greediest organ when it comes to glucose intake. So the more muscle you have, the more storage capacity for glucose, which means it gives you a little bit more leeway to have that extra chapati without that going into your liver and sitting as fat. You know what I mean? It's going to get consumed as active energy. So movement is the other one. The fourth really interesting one is sleep. This sort of falls in the space of stress, but sleep is this nature's medicine. And that is, highly encourage all of you to not skimp on that. And there's a whole thing called sleep hygiene, right? You just have to do it to get a good night's sleep. What happens in that deep sleep state is magical for your body, and again tied to insulin resistance, again tied to these biomarkers. So, and I think the fifth one, which is not a what you could do, it's a little different, but I think it's also something you could do, which is measure what matters. If you're really curious and you want to take stock of your health, go get a CGM, a continuous glucose monitor, plug it on yourself, see how the food you eat is what it's doing to your body, right? Measure it yourself. Be curious, right? I really encourage all of you to be curious, because only you know what's happening in your body, right? See if that, because we've seen patients where the same food elicits a very different response. Yeah. Right? Like oats as an example. There are some people whose glucose spikes like crazy, right, with oats or idli, but then there's some people it doesn't, right? And so measure, if you're really curious, measure. And if you cannot invest in a CGM, then at least be mindful. After I ate that food, did I feel energetic? Did I feel lousy? Did I want to go sleep? Was I feeling alert, or was I feeling like there was a brain fog? You could do these like basic things on a day-by-day basis, being more mindful about how you're feeling after what you eat. And did the food you eat make you hungry within 2 hours, right? So some very, very small things. You don't need an expert. You become the expert of your body, right? And I think that's important. And I think Dr. Sonia summed up everything else really well. I think in future episodes, we love for you to stay tuned, where we, today we've scratched the surface, and this is barely anything. And I think in the future episodes, it's imperative that we, start taking each topic, breaking it down for you, whether it is nutritional sciences, whether it's metabolic health, whether it is skin-related issues, metformin. I think there's so many things to uncover and bring an evidence-based, science-based approach to health conversations, right? And I couldn't ask for a better collaborator than Dr. Sonia here, who's so rooted and grounded in science, especially in what she does in her clinic here. Thank you so much for listening to us today. Do you have any final thoughts to share, Dr. Sonia?
No, I think very well said. Everything has been summed up very correctly. I think this is kind of setting a base for us, and we are going to build up on this. I think in our next episode we will decide that which direction either we are going to discuss about the dietary aspect, the physical movement, stress, because each of them is like a big huge topic.
Yeah.
Very well said about sleep.
Yeah.
I think a lot of people don't understand the importance of how important a basic thing as sleep is. So we will go deep into all these topics one by one. And thank you, Saujanya,
Thank
for
you.
giving so much insight to us. And please let us know if there is any particular thing in today's podcast that you want us to take next.
Yeah. I'd love a Q&A from you guys so we can research those topics and bring to you. You can find me at my website, www.saujanyavemuri.com. Follow me. You'll have the links to follow me on social media via that website. And I think Dr. Sonia, where can they find you if they?
Yeah, so I am at the clinic website. I am there. So our Instagram handle and website, everything is going to be mentioned at the bottom of the podcast itself. And I think also I want to thank my team at Sikara Clinic for being so patient. And that's it from us.
Yeah. Stay tuned, guys, and be well. Until next time, take care. Bye.
Thank you. Bye.